From a health post to one of the most viable hospitals in the Gambia, the Bundung Maternal and Child Hospital has become a prominent healthcare provider, immensely transforming maternal and child health development in the Gambia. This median performance review at the maternal hospital aims to promote access to activities and expand services delivered by the health center, which incorporates awareness raising and education as a significant part of its outreach programs for mothers and children. Hospital officials say the seminar will help identify and evaluate gaps and successes the hospital has registered in recent years and strategies to boost the hospital's development and service delivery for the population. Dr. Mamadi Cham, the CEO of the hospital, said, "The performance review is a critical exercise necessary to assess patients' needs and expand efficient services for maternal development."
When I arrived at Bundung, the culture of records was implanted, though it took time for people to acclimatize themselves. As we know, most of the time when people start introducing new things in Gambia, they will say, do yaga, it's just the beginning. But up to December, it never faltered, so that helped us. And I must here at this juncture recognize the hard work of the staff. As we move at the deeper, you can see the staff were more interested in data than ever before. That made it possible. I will assure you also, the records we provide here are very accurate, because we always counter-check our data. We value our patients and our clientele, and that is why that ushered us to get these things going.
Dr. Mustafa Bite, the Director of Health Services and a hospital board member, said the review meeting encourages dialogue for best practices and accountability in the work being done in the healthcare system.
This is a process to help us strengthen Bundung. We don't expect only praises. We want praises where we've done well, but we want to hear your candid and objective criticisms so that we will improve as we go ahead. We are happy that there is accountability, and that has to continue. And we are happy that the staff embrace that. So when you want to do accountability and people say, no, we don't want it, then it will be very difficult for it to happen. So we are appreciative of the good work the staff is doing. The dialogue between the hospitals, we are very encouraged as a ministry because they share amongst themselves resources. They share best practices. But we encourage you to continue that so that our health system is just one unit.
Njie, the Permanent Secretary of the Ministry of Health, underlined the strong commitment moving to overcome challenges faced by the health sector.
Our convergence here today to look at the performance of the Bundung Maternal and Child Health Hospital, and through the Bundung Maternal and Child Health Hospital, the performance of the entire Ministry of Health across the spectrum of services is paramount, and we believe that at the end of the day, with your input and your fruitful contributions, we will be able to better reprogram and readjust ourselves on areas where we fall short of the targets, and also have a clear vision of how we brace ourselves to consolidate our gains so far.
PSJT called on other health institutions to hold such review seminars to help the ministry's evaluation of performance needed to guide the country's health system. Hawa, Njie, GRTS News.